The population that has gotten the coronavirus vaccines in the United States so far looks whiter than the general United States population. And it's still whiter than the high priority groups like healthcare workers and the elderly. Advocates say that this is driven by local decisions like vaccine sites being placed in inconvenient places, signups through online portals, and vaccine availability in limited hours on limited days. That means that people who have poor internet access, limited English language or technical proficiency, and limited access to transportation options or the kind of schedule flexibility needed to get the vaccine aren't able to get it. Now, the Biden administration has said it intends to address these issues by a number of things, including 3 programs announced over the last few weeks intended to put more vaccines in underserved communities through vaccine sites operated by FEMA, federal partnerships with pharmacies, and now community health centers. But advocates say that this might not be enough. The Biden administration says that it wants to put out 11 million vaccines a week with the intent on getting even more.
And today we're announcing that we will increase weekly vaccine doses going to states, tribes, and territories to 11 million.
But state and local health officials worry that they don't have the infrastructure to make sure that those vaccines are targeted to the people who need them the most. Many of these organizations are still waiting on funds to support the vaccine rollout and using things like Sign Up Genius to get people signed up for the coronavirus vaccine. But that doesn't address the long-term inequalities that people are seeing crop up in trying to get the coronavirus vaccine out into the public. This is actually showing up in the data about the vaccine itself, as fewer than half of states are reporting the demographic data about who is actually getting the vaccine. And advocates say that there's no quick fix here, and it's going to take some time to try and get the vaccine out to underserved communities, people who have been hit the hardest, and people who are the most vulnerable to getting the coronavirus.